everyone. My name is Thaísa, and I will present my study about Alzheimer's disease and type 3 diabetes mellitus. First of all, I would like to present myself. My name is Thaísa Lopes Rodrigues. I am a Brazilian, 21 years old, and I'm a nutritionist. I've just graduated from college. I'm starting graduate studies in sports and aesthetic nutrition. I've already presented 2 researches in a Brazilian congress named SBAN. I am very interested in functional nutrition, so I took a lot of courses in this area and I intend to take more. And I am a very inquisitive person, always trying to learn something new, like a new language or a new subject. But let's go to what really matters here. So let's start talking about diabetes mellitus, which is an important and growing health problem that afflicts many countries around the world. According to the Brazilian Diabetes Society guidelines in 2020, if the current trends persist, it is estimated that in 2045, 628.6 million people may have this disease. In recent years, the fall of infant mortality and fertility have resulted in aged population, and consequently arises the chronic non-communicable disease such as diabetes, especially the type 2, which is associated with obesity and overweight. Diabetes can be classified in types. The most common ones are the type 1 diabetes, which is characterized by the insufficiency of pancreatic beta cells and absolute insulin deficiency, and is most common in childhood and early adolescence. The type 2 diabetes is characterized by the relative deficiency or peripheral resistance to insulin. It corresponds to 85 to 9% of all DM cases, and its diagnosis occurs later, mostly after 40 years of age, or in obese children or adolescents. And the gestational diabetes, which arises in pregnancy and normally stabilizes after the delivery. But as the woman has this type of diabetes, it increases the likelihood of developing the type 2 in the future. And there's the other specific types of DM.
Thaísa, excuse me. Can you move the slides, please?
Oh, here, did I change it?
No.
Oh God. Let me try again. Can you see now? Yes?
Yes.
Okay. Let's try again. Do you want me to say it again or it's fine?
No, you may carry on.
Okay. And the most studied type recently is the type 3 diabetes. Did the slide change it? The slide moved?
No.
Oh my God.
You need to move it manually.
Yeah. Now?
Yes.
Yes. Okay. So the type 3 diabetes mellitus, which is characterized by insulin resistance within the brain, that leads to a great impact on neurocognition and can lead to Alzheimer's disease. This term, type 2 diabetes, is because it correlates risk factors for the development of Alzheimer's disease, such as obesity, type 2 diabetes, and insulin resistance. So, Alzheimer's disease is the most common form of dementia. It occurs more than 50% of the cases and is more common in elderly aged over 65. It's a neurodegenerative disorder that leads to a memory loss, concentration difficulties, language problems, motor functional disability, apraxia, agnosia, aphasia, cognitive and behavior changes, and all of this leads to impairment of functional activities. The relation between diabetes mellitus and Alzheimer's disease. Both are chronic disease with common etiological factors. such as inadequate diet and lifestyle, vascular risk factors, and metabolic syndrome, which is an independent risk factor for developing Alzheimer. Therefore, this relation between these two diseases is called metabolic cognition syndrome. It changed?
No. Yes.
And it can be explained by the fact that the brain produces ATP exclusively from glucose, and diabetes impairs the brain's ability to metabolize glucose. So, central nervous system is unable to protect the synapses with resulting cognitive alterations that can lead to Alzheimer's disease. Other factors that indicate the likely relationship between these two diseases are the tau protein hyperphosphorylation, neuroinflammation, alterations in the function of brain macrophages, and insulin resistance that is also an independent risk factor for developing Alzheimer's disease. Insulin and insulin resistance. Insulin has an important role in the cognitive functions as it modulates protein in synaptic synthesis. So if there is an insulin resistance, it can lead to an increase on neuronal levels of glucose, acetylcholine, cholesterol, ATP, protein synthesis, and synaptic remodeling. And it can increase membrane instability and production of reactive oxygen species. It can lead to neuronal damage and death. So the objective of my study is to verify the prevalence of diabetes mellitus among the individuals with Alzheimer's disease. Methodology. It was a descriptive, observational, cross-sectional study. It was carried out between June and November of 2021. 100 elderly people aged 60 years or over of both genders and diagnosis with Alzheimer's disease were studied, and the research participants were the direct family members or caregivers with 18 years or over of these elderly people. It was an online questionnaire developed and answered on Google Forms, and the results were tabulated in Microsoft Office Excel 2020. There were sociodemographic, anthropometric, and clinical questions, and some scales like QADS ADL index, Lawton IDL scale, and QGRS adapted. So the QADS ADL index, or BADL, it measures functional status and basic activities of daily living, such as bathing, dressing, grooming, transferring, sphincter control, and feeding. It can all determine the autonomy of the elderly. The Lawton IDL scale, or AIDL, measures 7 instrumental activities of daily living, such as managing communication, managing transportation, shopping, house cleaning, home maintenance, meal preparation, managing medication, and managing finances. Combined with the other scale, it can determine better the autonomy of the elderly. And now the Quick Dementia Rating System, or QGRS, by James E. Galvin, is a reliable, brief system to differentiate individuals with and without dementia, providing accurate stagings of individuals without a trained staff. It was adapted for this study with only 5 questions because the other 5 were really similar to the BADLs and IADLs, and to facilitate participants' response to the questionnaire. Students' t-test was applied to verify the relationship between diabetes mellitus and aspects related to Alzheimer's disease. And the Pearson correlation coefficient was used to analyze the correlation between the duration of diabetes, lesser autonomy of the elderly, measured by the BADLs and IADLs, and greater behavior changes. The results. First of all, let's take a look on the table 1 that shows the percentage distribution of elderly people with Alzheimer's disease according to socio-demographic characteristics and presence of diabetes. So here is the genders, schooling, and nutritional status. So the mean age was 82.3 years, GP more or less 7.9. Most of them were female, which agrees with the results found on study of Vidor, Sakai, and Magajeski, 2019, where they analyzed the association between the evolution of mortality related to Alzheimer's disease and AGI's components in Brazil, and the participants were most female. The most of participants had a low level of education, which also explained in the studies, such as Barroso and others, 2020, that shows there is a strong relationship between lower education level and poor cognitive ability. And most of them were obese or overweight. In a study of Balbino 2021, it shows that obesity is a risk factor for dementia in elderly due to the oxidative stress, endothelial dysfunction, and inflammation that it generates. Now, let's go to the table 2 that shows the percentage distribution of Alzheimer's patients according to the presence of diabetes. Here there is the duration of diabetes, use of medications, degree of dependence by BADL, degree of dependence by EADL, and evaluation of dementia by QDRS, and here the p-value. So, in this table, we can see that people that has Alzheimer's disease and diabetes have a worsening of dementia independence condition. It can be explained by the study of Bay and Song 2017 that shows that glucose metabolism and insulin resistance lead to a severe cognitive impairment and a worse prognosis for the disease. In another study of Al-Janabi and others of 2020, it shows that small changes in glucate hemoglobin levels or even just the presence of diabetes could significantly change the performance of patients in cognitive tests. Also, most of the patients have a family history of Alzheimer's from non-first degree relatives. In a study of Cannon Albright and others, 2019, shows the same results and says that Alzheimer's in second and third degree family could significantly increase the chance of its occurrences. The most pre-existing comorbidities were hypertension and diabetes. In a study of Mendes and others of 2016, there was as well predominance of hypertension over the other comorbidities. Most of them had type 2 diabetes. And in a study of Lieue and others of 2020 shows that having the type 2 diabetes leads to a 50% risk of developing Alzheimer. Most of them also had a family history of diabetes from first degree relatives. And Lima and others of 2018 explained that there is a significant association between family history and a higher occurrence of diabetes, especially type 2 diabetes in first degree relatives. And to finish this table, the most used medication were metformin and insulin. In a study of Silva and Alves 2018, the same result, but only the metformin was the most used for the treatment of type 2 diabetes. Now, the figure 1 that shows the elderly with Alzheimer and diabetes distribution, analyzing their dependence and dementia according to the time of diabetes. If we look here, we probably think that more you have, more years you have diabetes, more dependence you have. But as we apply the Pearson's linear correlation coefficient, the duration of diabetes had a very low intensity correlation with Alzheimer's duration, a very low intensity correlation with the degree of dependence as assessed by both the BADL and IADL scales, and a very low intensity correlation with the degree of dementia as assessed by QDRS. So we can see that the existence of diabetes can advance or cause Alzheimer's disease. However, in this study, the duration of diabetes was apparently not related to the worst prognosis of Alzheimer's disease. As a conclusion, we can see, that most Alzheimer's patients were female with a low level of education and overweight or obese. We found a positive relationship between the presence of diabetes and a worse prognosis in Alzheimer's disease, but there was no relationship between the duration of diabetes and the worsening in Alzheimer's disease. Further studies are suggested as the sample size is too small to extrapolate the result to the whole population. Here are my references. Okay. Thank you.